Hi, Dr. Paul Coleman, Coleman Center for Cosmetic Dentistry with this week's Dental Health with Dr. C. I'm going to talk about something that has a wide range of applications, and it's a relatively quick fix. If you're not real pleased with the way your teeth look, or if you're missing some teeth, or even if you have an implant that's being installed and you can't load it up for a while, and you really don't want to walk around with that gap in there, there's a fairly low-cost solution that actually works pretty well. And what it's called is Snap-on Smile. What Snap-on Smile is you can take someone that's got some gnarly looking teeth, and for relatively small money we can have made by the laboratory, in essence, a whole new smile. This is fairly flexible, and you can go from looking like this to looking like that in 2 visits. Now, what's really cool about this, it has a lot of applications. What I mostly use it for is for a patient that anticipates doing a full mouth rehabilitation or getting a new smile, but they're not really sure if they can afford it just yet while they get their finances together, or even if they just want to test drive seeing some longer teeth. I mean, if you ground your teeth off and you kind of get used to them getting shorter and shorter, it's kind of startling when they're back to full size again. So actually, I just got off the phone with a young guy, and he's a great guy, and he is anticipating that we're going to rebuild his mouth in porcelain. But it's going to happen over a period of time this year, and while he's accumulating the funds, I really wanted him to get used to smiling and seeing people look at him and say, wow, he's got front teeth, this is kind of cool. Now this is the young man right here. Young man means anybody under my age, frankly, so young man's a relative term. But this was his before photo, and as you can see, they're pretty badly worn, and they're kind of short and kind of chipped off. And in 2 visits, we went from looking at that to looking at that. Okay? It's kind of startling. And I called him up today, and he's just like thrilled with the way they look. He's getting positive comments. He goes, you know, I don't know how to value the increased confidence that I feel now. He goes, I have to learn how to smile again, because for so many years I was cinching my lip up every time somebody picked up a camera. So, I mean, how does this translate into his social activities, and how does it translate in the job? I mean, you only get one shot at a first impression, and if you blow it, it's gone for good. So, if you have some spaces, if you have some worn teeth, and you're thinking, yeah, I'd like to do a full-blown case, this is relatively small money. An upper and lower case is really the cost of a couple of veneers. And if you're not in a position to, at this period in your life, really do it the ideal way, this might be a real sensible solution for it. So ask your dentist about it. It's called Snap-on Smile, and if he has some concerns, or he's not sure that he's ever felt comfortable doing it, or doesn't know what it's about, give me a call. I'll help you out and help you find somebody. So if you had teeth that looked like that, and you want them to look like that, check it out. Snap-on Smile. That's this week's edition of Dental Health with Dr. C.